Hi, my name is Erica and I'll be your student nurse. Today I will be accessing an implanted port. So the first thing that I would do is I would go into the room, I would wash my hands and put on gloves. I would also ask the patient to state their name and date of birth, and I would use two forms of identification, either his wristband, him saying it back to me, or the MAR. I would then go ahead and I would also assess for allergies. I would then palpate the area to find the implanted port, and once I found it, I would just also assess it for any redness, swelling, ask the patient if they're experiencing any pain. Then I would get my Huber needle all set up. So here I have my PosiFlow, which I will just open up and let it sit right there. And then I have my Huber needle, which I will also open up only enough to have part of the line sticking out that I'm going to attach my PosiFlow. And then I also have my normal saline syringe. So I'm going to take my PosiFlow and attach it to my Huber needle. And then I would, if I want to, I could alcohol it off for 15 seconds, but I shouldn't need to because it was just out of its sterile package, but can never be too safe. And then I'm just gonna take my normal saline and attach it to my PosiFlow. And I'm just gonna prime it. So I'm just gonna push in maybe a milliliter until I see it coming out of the needle end. So then I'm going to take that and I'm just gonna set it aside until I need to use it. So then I would go ahead and I would take my gloves off and I would wash my hands or use gel. I would come over to my area that I'm going to be setting up my sterile field, and I would alcohol it off, wipe it down, and then I would allow it to dry. I would then take my sterile kit and I would open it up. The first thing that I have is a mask. I would make sure to give that to the patient so they can have a mask on, and then I would also have a mask on. I have my gloves, which I will set right here to put on in a second, and then I have my sterile field. So I'm just going to take that out of its tray, and I'm going to open it up. So there's my sterile tray, or my sterile field, and it does not come with a BioPatch on, so I have one here that I would then have to open it up, and I would fling it on there, and then that would be garbage. So making sure that I don't turn my back to my sterile field, I'm going to come and I'm going to put on my sterile gloves. Again, I would have washed my hands or gelled my hands prior to putting these on. Okay, now I'm just going to come over to my sterile field and make sure that I have everything separated that I need. So then once I have that done, I'm going to take my chlorhexidine and I'm just going to crack it open. And again, I'm going to come over to my access port and I'm just going to clean it off for 30 seconds each way using friction. Okay, and I'm going to go sideways. And then my last motion is just going to be in a big circular motion. Making sure I get the whole area. And then once I'm done with that, I would dispose of that and I would allow my area to dry. Taking my non-dominant hand, I'm going to grab my normal saline syringe. So this hand is now contaminated. I'm just going to take my needle out, and then I'm going to grab the needle end with my dominant hand and taking the cover off. I'm then going to find my port, and I'm just going to insert the needle. And then I'm just going to double check to make sure my clamps are open. They should be open, and I'm going to aspirate for blood return. Once I note blood return, I'm going to inject the normal saline using the push-pause method. And then I would clamp my line. I would take my normal saline syringe off. I would grab an alcohol swab, and I would alcohol off for 15 seconds. And then I would come over to my sterile field again, and I would grab my bio patch. And I would put my bio patch around my needle. And then I would also grab my transparent dressing. And I would apply my transparent dressing so that the Huber needle is visible. I would also note for any redness, swelling, ask the patient if they are experiencing any pain. I would take my gloves off. I would document and wash my hands.